I started the program talking about certain peak business bodies and the aged care sector calling for compulsory COVID vaccines for workers. Daisy, what are your feelings about the mandatory vaccine program? I think in the aged care sector, where they already have to have mandatory flu jabs, it makes sense. But what do you think about other sectors?
No, I am very against a mandatory COVID vaccine for all industries unless they really are high risk in terms of not having one. Of course, as you mentioned, the aged care sector, we saw so many deaths in the aged care sector because of COVID. I think it perfectly stands to reason to make it mandatory in that sector. As you mentioned, they've already got a compulsory flu jab, and I think even if you didn't make it mandatory in the aged care sector, employees would do it anyway, because if you're talking about mitigating risk, I mean, there's always a risk with any vaccine, and particularly this is a new one, we're not quite sure of it, but if you're weighing up, well, I could get COVID or give it to someone who's vulnerable, or I have a small chance of a risk with this vaccine, probably you'd pick the COVID vaccine. I understand that. As for other sectors, no. COVID is a disease that kills less than 1% of people who get it, according to the American CDC. 80% of cases will be asymptomatic to mild, according to the World Health Organization. We know this. There is no need to be forcing vaccinations onto people in industries which just have such a small risk, or they're amongst low-risk people, etc. I find it vile to actually suggest it and a total infringement on people's personal freedom. I reckon, though, Australia, I believe, has quite a high uptake of vaccines anyway. And now I'm very pro-vaccine. Generally, most people seem to be. So I actually don't think we'll have much trouble getting Australians to actually volunteer for a vaccine.
Prue, we've even had the Qantas CEO come out and say, never mind staff, he wants any passengers who want to fly with Qantas internationally to have vaccines, or they're not allowed to board. Do you think people will accept those sort of conditions because they have just been so damaged by what they've seen this year that they'll cop it? They've copped plenty of other things this year.
Well, I think they will. Well, if they don't, they won't fly. So it's very simple. Look, I get what Daisy's saying, and there are, bodily integrity rights and all of these things. But looking at it from a business perspective, I would insist, because I will be up for all kinds of litigation if my employees under the OH&S Act, suddenly get COVID. Am I going to be implicated and sued? I really think that there are exceptions. I know the Victorian Public Health Act, and I think even in the ACT, they can make it mandatory for you to be vaccinated. So there are precedents in this. Look, I would hope...
That's true, Prue. Sorry, Prue, I've just got to wrap it up, but I love it when we disagree. So we're covering all our bases. Thank you, Prue McSween and Daisy Cousens, for joining us tonight.